Asthma is a chronic respiratory condition that affects millions of people worldwide. It causes the airways in the lungs to become inflamed and narrowed, making it difficult to breathe. In this video, we'll explore what asthma is, how it impacts the body, and the steps involved in diagnosing it. Whether you or someone you know has asthma, understanding this condition is the first step toward effective management. Let's begin by looking at the basics of asthma and why it's such a common concern for both children and adults. Asthma is more than just occasional shortness of breath. It's a long-term disease that causes recurring episodes of wheezing, chest tightness, coughing, and breathlessness. These symptoms can vary in severity and frequency from person to person. Asthma can be triggered by a variety of factors, including allergens, exercise, cold air, or respiratory infections. The underlying problem is inflammation and sensitivity of the airways, which leads to swelling and excess mucus production. This makes it harder for air to move in and out of the lungs. The symptoms of asthma can range from mild to severe and may change over time. Common signs include frequent coughing, especially at night or early morning, wheezing, a whistling sound when breathing, shortness of breath, and chest tightness. Some people may only experience symptoms during certain activities, like exercise, while others may have persistent issues. Recognizing these symptoms is crucial for early diagnosis and effective management. Asthma attacks can be triggered by a variety of factors. Common triggers include allergens like pollen, dust mites, pet dander, and mold. Other triggers are respiratory infections, cold air, smoke, strong odors, and even stress. Physical activity, especially in cold weather, can also provoke symptoms. Understanding what triggers your asthma is an important part of controlling the condition and preventing attacks. In asthma, the airways become inflamed and swollen. The muscles around the airways tighten, and the lining produces extra mucus. This combination narrows the airways, making it harder to breathe. During an asthma attack, these changes become more severe, leading to increased difficulty in breathing and more pronounced symptoms. This is why asthma is sometimes described as an obstructive lung disease. Asthma can affect people of all ages, but it often starts in childhood. Some people may outgrow their symptoms, while others continue to have asthma into adulthood. Genetics play a role, so if you have a family history of asthma or allergies, your risk is higher. Environmental factors, such as exposure to tobacco smoke or air pollution, can also increase the likelihood of developing asthma. Children are particularly susceptible to asthma, and it's one of the most common chronic conditions in childhood. Symptoms can sometimes be mistaken for respiratory infections or allergies. Parents should watch for frequent coughing, especially at night, and difficulty breathing during play. Early diagnosis and proper management can help children lead active, healthy lives. While asthma often begins in childhood, adults can develop it too. Adult-onset asthma may be triggered by workplace exposures, allergies, or respiratory infections. Symptoms can sometimes be more persistent and severe in adults. It's important for adults to recognize the signs and seek medical advice, especially if they experience new or worsening breathing problems. An asthma attack occurs when symptoms suddenly worsen. The airways become extremely narrow, and breathing becomes very difficult. Attacks can be triggered by allergens, infections, exercise, or even emotional stress. Quick relief medications, like inhalers, are essential during an attack. Severe attacks can be life-threatening and require immediate medical attention. Diagnosing asthma involves a combination of medical history, physical examination, and lung function tests. Doctors look for typical symptoms and ask about any triggers or family history of asthma or allergies. Since asthma symptoms can overlap with other conditions, a careful evaluation is necessary to confirm the diagnosis. The first step in diagnosing asthma is taking a detailed medical history. The doctor will ask about your symptoms, how often they occur, and if anything seems to trigger them. They'll also inquire about any family history of asthma, allergies, or other respiratory conditions. This information helps guide further testing and narrows down possible causes. During a physical exam, the doctor listens to your lungs with a stethoscope, checking for wheezing or other abnormal sounds. They may also look for signs of allergies, such as nasal swelling or skin rashes. While a physical exam alone can't confirm asthma, it provides important clues and helps rule out other conditions. Lung function tests, also called pulmonary function tests, measure how well your lungs are working. The most common test is spirometry, which assesses how much air you can exhale and how quickly. These tests help determine if your airways are narrowed and how severe the obstruction is. Results are compared to normal values for your age, height, and sex. Spirometry is a simple breathing test that measures how much air you can blow out and how fast. You'll be asked to take a deep breath and exhale forcefully into a tube connected to a machine. The results show how well your lungs are functioning and can help diagnose asthma or monitor its severity. Another tool for diagnosing and monitoring asthma is the peak flow meter. This handheld device measures how quickly you can blow air out of your lungs. Lower than normal peak flow readings can indicate airway narrowing. Regular monitoring helps track asthma control and detect early signs of worsening symptoms. Doctors may perform a bronchodilator response test to see how your lungs react to asthma medication. After an initial spirometry test, you'll inhale a bronchodilator, which relaxes the airway muscles. The test is repeated to check for improvement. A significant increase in airflow after medication supports an asthma diagnosis. If standard tests are inconclusive, a methacillin challenge test may be used. Methacillin is a substance that can cause airway narrowing in people with asthma. You'll inhale increasing doses while your lung function is measured. A drop in lung function after inhaling methacholine suggests asthma. The exhaled nitric oxide test measures the level of nitric oxide in your breath, which can indicate airway inflammation. High levels are often seen in people with asthma. This test is non-invasive and helps guide diagnosis and treatment decisions, especially in difficult cases. Since allergies are a common asthma trigger, doctors may recommend allergy testing. Skin or blood tests can identify specific allergens that provoke symptoms. Knowing your triggers helps you avoid them and manage your asthma more effectively. A chest X-ray isn't used to diagnose asthma directly, but it can help rule out other conditions that cause similar symptoms, such as infections or structural lung problems. It's a useful tool when the diagnosis is unclear or if symptoms are severe. Asthma symptoms can mimic other respiratory conditions, such as chronic obstructive pulmonary disease, COPD, bronchitis, or heart problems. Doctors use a combination of tests and clinical judgment to distinguish asthma from these other illnesses. Accurate diagnosis ensures the right treatment plan. Once diagnosed, asthma is classified by its severity: intermittent, mild persistent, moderate persistent, or severe persistent. This classification is based on how often symptoms occur, how severe they are, and how much they interfere with daily life. Severity guides treatment decisions and helps monitor progress. Intermittent asthma means symptoms occur less than twice a week, and nighttime symptoms less than twice a month. People with this type usually have normal lung function between episodes and don't need daily medication. Quick relief inhalers are used as needed. Mild persistent asthma is characterized by symptoms more than twice a week, but not daily, and nighttime symptoms 3 to 4 times a month. Lung function remains mostly normal, but daily low-dose medication may be recommended to keep symptoms under control. Moderate persistent asthma involves daily symptoms and nighttime symptoms more than once a week. Lung function is reduced, and symptoms can interfere with daily activities. Treatment usually includes daily controller medications and quick relief inhalers as needed. Severe persistent asthma is marked by symptoms throughout the day, frequent nighttime symptoms, and significant limitations in daily activities. Lung function is often severely reduced. Intensive treatment with multiple medications is usually necessary to control symptoms. Doctors regularly assess asthma control by asking about symptoms, medication use, and activity limitations. Tools like the Asthma Control Test ACT help monitor progress and adjust treatment as needed. Good control means minimal symptoms and no activity restrictions. An asthma action plan is a personalized guide that outlines daily management, how to recognize worsening symptoms, and what steps to take during an attack. It helps patients and families respond quickly and effectively to changes in symptoms, reducing the risk of severe attacks. Asthma medications are divided into 2 main types: quick relief and long-term control. Quick relief inhalers provide fast relief during attacks, while long-term control medications reduce inflammation and prevent symptoms. Your doctor will choose the best combination based on your asthma severity and triggers. Inhalers are the most common way to deliver asthma medication directly to the lungs. There are different types, including metered dose inhalers and dry powder inhalers. Proper technique is important for effective treatment, so your healthcare provider will show you how to use your inhaler correctly. Ongoing monitoring is essential for asthma management. Regular checkups, peak flow measurements, and symptom diaries help track control and detect early signs of worsening asthma. This proactive approach helps prevent severe attacks and keeps symptoms under control. Asthma and allergies often go hand in hand. Allergic asthma is triggered by exposure to allergens like pollen, dust mites, or pet dander. Managing allergies through avoidance and medication can help control asthma symptoms and reduce the risk of attacks. Controlling your environment is a key part of asthma management. This includes reducing exposure to triggers like dust, smoke, and strong odors. Using air purifiers, keeping your home clean, and avoiding tobacco smoke can make a big difference in symptom control. Exercise is important for overall health, and most people with asthma can be active with proper management. Warming up, using prescribed inhalers before activity, and choosing suitable sports can help prevent exercise-induced symptoms. Always follow your doctor's advice for safe exercise. Respiratory infections like colds or the flu can worsen asthma symptoms. Getting vaccinated, practicing good hand hygiene, and avoiding sick contacts are important preventive steps. If you develop an infection, follow your asthma action plan and contact your doctor if symptoms worsen. Smoking and exposure to secondhand smoke are major asthma triggers. They increase airway inflammation and make symptoms harder to control. Quitting smoking and avoiding smoke-filled environments are essential for anyone with asthma. Air pollution, including outdoor smog and indoor pollutants, can worsen asthma symptoms. Monitoring air quality, staying indoors on high pollution days, and using air filters can help reduce exposure and prevent attacks. Weather changes, especially cold air or sudden temperature shifts, can trigger asthma symptoms. Dressing appropriately, using scarves in cold weather, and staying indoors during extreme conditions can help minimize weather-related attacks. Strong emotions like stress, anxiety, or laughter can sometimes trigger asthma symptoms. Learning stress management techniques, practicing relaxation, and seeking support can help reduce emotional triggers and improve overall well-being. Education is a key part of asthma management. Understanding your condition, knowing how to use medications, and recognizing early warning signs empower you to take control. Many healthcare providers offer asthma education programs for patients and families. Support from healthcare providers, asthma educators, and patient groups can make a big difference. Sharing experiences, learning from others, and staying informed about new treatments help you manage asthma more effectively. With proper management, most people with asthma can lead normal, active lives. Regular follow-up, adherence to treatment, and trigger avoidance are key. Severe asthma can be challenging, but advances in treatment continue to improve outcomes. Uncontrolled asthma can lead to complications, such as frequent hospitalizations, missed work or school, and reduced quality of life. Severe attacks can be life-threatening. That's why early diagnosis, proper treatment, and regular monitoring are so important. Living with asthma means being proactive about your health. By understanding your triggers, following your treatment plan, and staying in touch with your healthcare team, you can keep symptoms under control and enjoy a full, active life. Remember, asthma doesn't have to hold you back. In summary, asthma is a common, chronic lung condition that can be effectively managed with the right approach. Early diagnosis, understanding your triggers, and following a personalized treatment plan are essential. With ongoing education and support, most people with asthma can lead healthy, fulfilling lives. Thank you for watching, and remember to take charge of your respiratory health.